I'm Dr. Raj, and my presentation is titled Global Ophthalmology, Bringing the World into Focus. I've always had this interest in pursuing global ophthalmology and giving back to, a disenfranchised community in some way, and I think this experience has really cemented that desire of mine. Not only can we go and do teaching and provide resources and help over there, but I do think that there's a lot for us to learn from those settings as well. I was born in South India and I lived there until I was 8 years old. And most of my family still lives back there. A lot of people on my mom's side of the family actually live in remote rural villages. It's really hard for them to get access to healthcare. It was really, really interesting to be able to travel out to these sites. One of the sites that I went to was about 2.5 hours away. And driving over there, I got to see the countryside, see how people in those areas of the country lived, and then being able to provide them the service of bringing them back their sight, giving them their vision back, and for some people, helping them regain their livelihood, was a really, really impactful experience. My grandfather was one of my inspirations to make this whole thing happen. He's someone that lived in rural South India, and he faced a barrier to eye care and couldn't get cataract surgery for a long time for multiple reasons. When he finally had cataract surgery done, he came out into the waiting room in tears and hugged my father, thanking him for getting him to have cataract surgery, because he didn't even realize that he was supposed to be seeing as well as he was. And he had gone a long time without that knowledge. There's a lot of different really good food to try in South India, very authentic. This is food that I grew up with, food that I ate day to day, and it's not really something you can get anymore in the United States.
I actually got to work with a pediatric ophthalmologist, because that's the field that I'm going into for my fellowship. The next day I also got to work in the operating room, so this is just me with Dr. Akshay, who's the pediatric ophthalmology attending, and then one of the residents that was working.
Planning and completing a trip to India it's quite an ordeal. The whole trip from here to there takes 25 hours, and one of the biggest barriers I think for a lot of people from completing this sort of trip is the financial burden.
This was done thanks to a group from the GME. I was able to do it as a global health elective, and also thanks to financial support from the Meadows Fund. Dr. Meadows is an Ohio State ophthalmology resident who graduated in 2005. He unexpectedly passed away from leukemia in 2017, and we very generously donated money for residents to be able to do trips like this.
The Global Health Elective was a great opportunity for me, and I know that it's something that will be a career-defining moment, and it was made possible thanks to the Meadows Fund, the Pajka Fund, as well as the upcoming Fogarty Fund.